Welcome to Pharmacy Calculations with Jill Maceyko. Jill is a dedicated pharmacy technician instructor with a passion for empowering future healthcare professionals. With a background in both pharmaceutical education and innovative approaches to memory retention, Jill integrates music-based learning techniques to enhance student engagement and long-term recall. Committed to accessible and effective teaching, Jill brings real-world experience and creative strategies to the classroom. Please welcome Jill Maceyko.
Welcome to the Pharmacy Technician Student Summit of 2026, provided to you by the National Pharmacy Technician Association. It's an honor to present this again this year. So let's get started. So today is Mastering Calculations, Pharmacy Calculations, and we're going to try to help you walk through with ease. Today's objectives, hopefully you're going to be able to understand why accuracy matters for patient safety. We're going to apply basic math concepts. We're going to build that foundation for accurate medication dosing. Understand that being afraid of math is a very, very good thing, but then overcoming that and that fear with lots and lots and lots of practice. We always want to feel that fear and do it anyway. Why math actually matters. First and foremost is always going to be patient safety. Part of patient safety is going to be, oh, crap. Can I start over again on that slide?
Yeah, for sure.
Okay, so we can edit that out. So the math actually matters for first and foremost is always going to be patient safety. Then we're going to talk a little bit about preventing and prevention of medication errors, ensuring that our pharmacies are compliant, and ethical treatment of all patients. Patient safety and well-being. If we give the patient the wrong dose, it's not just a math mistake, it's a patient safety issue. I personally have thought about it in a scenario at least once a day, if not more. Math in dosage calculations needs to be so precise that we want to treat our patients like we would treat our family members and of course ourselves when we feel like we're sick. When we practice math, this is where our diligence is going to pay off with knowledge and practice. We also want to prevent medication errors. We want to define it first as any preventable event that can cause harm to the patient. We want to reduce inappropriate medication usage while the medication is controlled by a healthcare professional. And errors can occur in any step of the process. Prescribers make errors all the time. We, as technicians, can transcribe them, inconsistencies in prescriptions as well. Dispensing, maybe we missed a count, maybe we forgot to add 5 with 30 tablets. Administration, and of course, monitoring. Compliance means that we're doing the things the right way every time, following laws, staying up to date, providing documentation, accuracy, and ensuring that every step in our medication process is safe and correct. I added ethical treatment for all patients in this particular PowerPoint because medications can be very expensive. So being precise and ethical in our calculations can relieve some of the burden of expenses for our patients, especially our older patients, some of our younger patients. And of course, with healthcare rising, this is going to be something that is going to be on our minds as we're filling prescriptions throughout the day. So let's go back to the basics. We're going to start at the beginning. We're going to refresh a little bit of what you know. We're going to look at number systems. We're going to look at elementary math. We're going to look at fractions and decimals. Do a little bit of time and temperature for hospital and regular time and temperature, and rules to follow. We're going to round. We're going to learn how and when, and of course, zeros, when we need to use them safely. Well, let's start with number systems. Everybody sees our Arabic numbers, which are the normal everyday numbers, which is 1, 2, 3, 4, 5, and so on. Sometimes within prescription safety mechanisms, we need an extra layer of protection when dispensing controlled substances. So we would go back up to Roman numerals. Roman numerals are an extra layer of protection when the prescriber wants to have that added security on something that's going to be a controlled substance. So here's a visual representation of the Arabic and Roman numerals. Always remember, when in doubt, ask questions. Elementary math, we're going to go easy. We're going to do defining addition. We're going to put numbers together to create another sum. So it's going to be 3 plus 2 is equaling 5. Subtraction, taking one or multiple numbers away from each other. Okay. Multiplication, repeated addition, and division, splitting a number into equal parts. Whenever you have a question about these, I personally love to use my calculator. I know a lot of people say over the years is if you need a calculator, I always want to make sure that I'm safe and using it. The dreaded fractions and decimals dilemma. Me personally, I hate fractions. One thing I still to this day, I continue to be fearful of until I realize we can use that calculator. I love making fractions into decimals, and then I can do it, and then I can change it back to a fraction from a decimal. So, but there are the examples at the bottom of the page. Fractions are like a half mean 1 out of 2 parts, and decimals like 0.5 mean the same as the 1/2 in a fraction. Hospital time or regular time, or also known as military time. In a hospital situation, we'll be utilizing more hospital/military time. So 12 o'clock in the morning would be 100 hours. If it's going to be 12 p.m., it's going to be 1,200 hours. So we want to make sure that when we're dosing on timed dosing to ensure that we don't have medication errors, we want to send up our medications to the hospital floor correctly at the specific time that it's going to be needed or before. Temperature in the daily living, obviously we still look outside and we are told our temperatures in Fahrenheit in the United States, but we are probably one of the few countries that are still left in the Fahrenheit. Medical care does rely on Celsius. It's a little bit more accurate, especially when we're utilizing other metric systems in our patients' charts. The easiest way that I've always remembered Celsius to Fahrenheit and Fahrenheit to Celsius is what's on the slide currently. So we always utilize what's in the parentheses first in any type of equation like this. So Fahrenheit minus 32 divided by 1.8 is going to be equaling to Celsius. And of course, Celsius times the 1.8 plus 32 is equaling our Fahrenheit. So within the example, we're just using 89.6 as Fahrenheit and 32 degrees as Celsius. Rounding, when and how. Rules for rounding. Any number over 5 will be rounded up, and any number below 5 is going to be rounded down mathematically. Sorry. Rounding, when and how. Rules for rounding. Any number over 5, you're going to go ahead and round that up. Any number below 5 is going to be rounded down mathematically. Hospitals, that's a little bit different because you can't really send up a 1,000 milliliter bag half full to a person. That's kind of not the way it works. You wouldn't send a half empty bag. When rounding, always follow your specific directions for your problem at hand. do your best and always ask questions if you need any help on those. When rounding, pay attention to the calibration of your tool that you are using to measure, especially if you're using injections and things like that. A 1 milliliter syringe can go to the 100th, whereas a 10 milliliter syringe only goes to the 10th. Rules for math, always precede that decimal with a 0. We always want to differentiate a whole number from a fractionalized number or a decimal, because we never want to mistake a full number for something that should be a fraction. Also, never use a trailing 0 after the decimal point if there's no other number, no other full numbers there. We don't want to mistake the oxycodone 10 milligrams for a full 100 milligrams instead of only the 10. And always use your correct unit of measurement. Every drug has a specific unit of measurement that it's always known for. Insulin is measured in units. Your Lantus, your Novolog, your Humalog, those are always U100, sometimes 500 units per 1 milliliter, depending on what the doctor orders. Let's talk a little bit about basic conversions. Metric to household, to apothecary, and to avoirdupois. We want to go back in time of pharmacy. We're going to talk about the apothecary system. The apothecary system was our original measurement and dispensing system for medications. We talk about grains. Okay, the metric equivalent to 1 grain is 60 milligrams. That's mathematically what most of us use these days, but there are some medications that still use the 65 per 1 grain. Things such as aspirin, acetaminophen, Tylenol, and a few other things. You might see your amber vials listed as drams. Okay, that's the space that's inside the amber vial. Its metric equivalent is going to be 5 milliliters. You have your ounces. A lot of times we do our liquids is where we might have these for oral liquids. So our ounces, the metric equivalent is 30 milliliters for liquids. And if you're weighing something for solid, it's 30 grams. And then every once in a while, you'll see a minimum for a drop. Those are specifically might be used for ears and eye drops. Not much anymore, but for the most part, it's something we like to cover just to make sure that you might see those in old notations. The avoirdupois, usually used for weighing everyday goods. We kind of harken back to ounce when you went to the local grocery store and picked up bags of rice, potatoes, things like that. You have your pounds, and of course, if you're needing more than that, you have your tons. So with apothecary, 9 out of 10 times you're going to see Roman numerals. Okay, so with the Roman numerals, you'll notice the ounce sign with the Roman numeral of 8 after it for this particular order. And then, of course, your sig is going to have the dram. It's going to be 2 drams. So you would convert that through. And, of course, you would have your directions, because currently we use mainly metric systems for most of our dosage. Well, this is something I found looking for some old prescriptions. I love looking at old prescriptions. I love collecting my old bottles of different types of prescriptions that might have happened back in the 1900s, early 1900s, late 1800s. And you'll notice this one has 4 grains of codeine sulfate. So this is kind of a fun one to look back at the old days. We get into our household measurements. Most common and familiar measurements for most of us in America, These are readily known in our own kitchen cabinets. Our teaspoons, our tablespoons, a regular 8-ounce cup, cups, an ounce, pints, quarts, and of course a gallon. Then of course we have our weights for pounds. Pharmacy calculations use the metric conversions because they're a little bit more accurate in dosage calculations. There are other parts of conversions, but the most common for pharmacy technicians for us to use and see within metric conversions in and of itself is if you're going from larger to smaller, you're going to multiply the number by 1,000. Or if you really can see that and just move your decimal point 3 spaces to the right, from smaller to larger, divide the unit by 1,000. Okay, and move the decimal places to the left. So metric conversion examples. Well, let's use a single gram as the base unit of measurement to move between notations. So you have your 1 kilogram, your 1 gram is your base. You're going to divide to go to a kilogram. You're going to multiply to go to a milligram. And then you're going to multiply again to go to a microgram. Remember, micrograms are going to be used for dosages that are going to be either toxic or very strong. If we're going to use measurements for liquids, we're going to use the liter as our base for intravenous fluids. Okay, and we're going to go from the big liter to 1,000 milliliters. You may also see or hear the notation of cubic centimeter. This is equal to a milliliter. There are some conversions that you might know or might need to know, especially if you're working in areas that are dealing with, especially for the top one here for drops, for ear drops and eye drops. Mathematically, we use 20 drops per milliliter. Most facilities that work in retail might be different. They might use 15 drops per milliliter just to make sure that the patient is going to have enough for their day's supply in case they miss their ear, they miss their eye. Happens with eye drops and ear drops, especially with children who might not be able to sit still and adult patients who might have shaky hands. Of course, 1 teaspoon is equal to 5 milliliters. 1 tablespoon is equal to 15 milliliters. You have your ounce of 1 fluid ounce is going to be 30 milliliters. 1 cup is going to be 240 milliliters. 1 pint is 480 milliliters. 1 quart, 960, and a gallon. And we all have to drink our water. So we're going to be drinking 3,840 milliliters of water every day. At least we hope to. Weight conversions, especially when you're talking about body weight. I personally want to be weighed in kilograms. Intellectually, I know that the kilograms and the pounds mean exactly the same thing, but I like the way it looks on paper. But 1 ounce is equal to 30 grams, 1 pound is equal to 2.2 kilograms, and 16 ounces is a pound, and that's 454 grams. So in the real world, when we deal with patients that might be of normal height and weight or pediatric patients, especially children, we definitely want to make sure that if we have to do a dosage calculation with milligrams to kilogram, we want to make sure that that dose is as accurate as possible for children. We want that dose to be safe and therapeutic, and we do not want to have them have too much medication where it may harm them. Okay, so the Jane Doe child is 10 pounds, 6 ounces. Let's change that to kilograms. Remember that there are 16 ounces in 1 pound. So we have to convert the 6/16 to the 0.7375 pounds, because now we can add them both together, the 10 pounds total and the 0.6 or the 0.375 pounds, to convert that. So the patient ends up weighing 4.72 kilograms. Works the same way with adults. Of course, our average adult weight currently, I believe, is 175 pounds. But as you know, Clark's rule uses 150 because it's an older rule. But 250 pounds divided by 2.2 is going to be 113.64 kilograms. So ratio proportion. We're going to be invited to the wedding. So ratio proportion calculations. We always want to marry our ratio proportion calculations on both sides of the equal sign to match the numerators in the same unit of measurements and the denominators in the same unit of measurements. The example on the slide is going to be the orders of 1,000 milligrams of Keflex. We have 500 milligram capsules. So we start with 500 milligram capsules over 500 milligram capsule. Hopefully you can have that one gone. So I'll start that slide over. Ratio proportion calculations. Ratio proportions, unit of measurements. You want to marry the numerators and the denominators to each other. So the numerators are going to match at the same unit of measurement as is the denominator. We're going to use 1,000 milligrams over X caps, equaling 500 milligrams over one capsule. We're going to cross multiply, and then now we know we need to get X alone, so you're going to divide the both sides. So now we know we're going to need 2 capsules for the single dose. My go-to, and 90% of the calculations that we do, is going to be the D over H times Q. You don't have to use this. I tell my in-class students, practice makes perfect. And if you like ratio proportion better, that's the best way to do. If you're comfortable with that, if that's something that you are going to know that you're going to be accurate in, use the ratio proportion. This is just something for you guys when you guys are ready to take your PTCB, your exam for the Pharmacy Technician Certification Board. You might be asked a question about what this means. So the D is called the desired dose. We divide that by the stock on hand, or the H, and then the Q is the quantity. This is going to be usually the dosage form, is going to equal the dose. We're going to bake something today. We're going to kind of bake it medication style. I like my cookies, but I also love my chocolate chips. So a lot of times if I'm craving a Reese's peanut butter cup and I don't want to run to the store, I eat some of my chocolate chips and peanut butter. So when we do that, we want to take our recipe and using the following way to reduce or enlarge to make what we would need for your baking, for your chocolate chip cookies. So your desired recipe amount, what you want to make. Say you want to make 10 cookies and your actual recipe amount is only 5 cookies. The amount of, you're going to divide the desired recipe by the actual recipe amount, and that's the number of times to multiply each ingredient. How much sugar, things like that. Summer protection. We're going to come up on summer. We're going to have hopefully everybody's going to have some fun, some sun, and unfortunately, possibly some sunburns. So we're going to make our own sunscreen. And let's stop the pain and the peeling in its tracks. 25% zinc oxide sunscreen. We're going to make 120 milliliters. We need 30 grams of zinc oxide powder, 1.25 milliliters of carrot seed oil, and then 88.75 milliliters of unscented lotion. We have our tic-tac-toe version to make certain types of medications that we might mix together in the pharmacy. Usually it's going to be the same type of medication. And then we need a median or a middle version of the dosage form. We also term this as allegations. So as you can see on the slide here, you have your high dose is going to be in the upper left-hand corner. Your low dose is going to be in the lower left-hand corner. Your desired percentage is always going to be in the middle. Your difference of your desired minus your low is going to be up at the upper right. So that's going to be how many parts of your high medication that you're going to be utilizing. And then A minus B, or the high minus the desired percentage, is going to be how many parts of the low. We still also have to use the total parts as well. So we're going to use a 90% solution and a 30% solution to make 1,480 milliliters of a 55%. So now we're going to figure out what parts of each strength should be used and what volume of each is needed for the prescription. So we're going to play the tic-tac-toe game. So you have your 90 up in the upper left-hand corner, your 30 in the lower right-hand corner, your desired percentages in the middle at 55. So we know we're going to have 25 parts of our high. We're going to have 35 parts of our low. We're going to have 60 parts of all of the mixture that we're going to make. So we're only going to have 617 milliliters of the 90% and 863 milliliters of the 30%. Now you've created a 55% out of two different strengths. So hydration for our patients immediately. You may notice in the lower hand corner that I have a picture of the Lehigh Valley Hospital. My house that I grew up in was not even a full block away from that particular fire during the holidays, or right after the holidays. So recently in Pennsylvania, the hospital did catch on fire and the patients had to be evacuated, which means we have to probably do a manual IV pump setup rather than utilizing maybe our batteries. Maybe the batteries on the pump in the hospital weren't charged. So we had to figure out how long an IV will last in milliliters per hour. So what would the flow rate for a liter running at 125 milliliters per hour be? So we're going to do a ratio proportion on this one. It's going to be 1,000 milliliters over X hours, equaling 125 milliliters over 1 hour. We're going to cross multiply and then divide, so we get 8 hours totally. Now, of course, when a situation such as this is, you would be trained in helping the rest of the staff evacuate the patients and help set those pumps up. Infusion rates in a hospital for medications, you have your macro drip sets. Those are 10 drops per milliliter, sometimes 20. It just depends on what you have in your hospital supply. But the most common drip set is going to be known as our pediatric or micro drip set, which is 60 drops per milliliter. So let's take our liter from the previous slide and calculate the drops per minute with a micro drip set. So when you look at infusion rates, you're going to be looking at volume, which has to be in milliliters, over time, which has to be in minutes, times your calibration drip set. Okay, so that means your 60 drops per milliliter. Okay, so we know we figured out that 125 milliliters is going over an hour. So rather than using the full bag, we're going to use just that hour. So 125 milliliters over 60 times 60 is going to be equal to 125 drops per minute. Since your milliliters do cross out, you're left with just the drops per minute in the notation for the math. Old school pediatric dosing. These are things that when I first started as a tech many years ago, these are the things that we used to do. We use more sophisticated measurements these days. We don't necessarily use these too much, but you still have to know them and make notations with the historical significance of children being dosed by household weight, age in years, or age in months. And then the adult dose is multiplied by that. Clark's rule, Young's rule, and Freed's rule. Clark's rule is by child's weight in pounds divided by 150 times adult dose equals child's dose. Freed's rule is age in years, age in months, and divided by 150 times the adult dose. And Young's rule is age in years divided by age in years plus 12, then multiplied by the adult dose. Well, as I started the slide, is we wonder why we cover them still. We just want to illustrate the importance of progress and safety for our youngest patients. Modern pediatric dosing. We have updated the way we dose children. Statistically, it's going to be milligrams per kilogram, as that is going to be more stringent state safety guidelines. We dose by strength of the medication per kilogram of each weight, or by body surface area, which it takes in consideration height and weight, and is notated as m squared or metered squared. So we have Emily, who's a 12-year-old girl weighing 110 pounds. So the doctor is ordering amoxicillin 40 milligrams per kilogram per dose. And then we have our dosage calculation. The amoxicillin is going to be utilized from 250 milligrams per 5 milliliters. So first and foremost, we have to figure out what our kilograms are. We have a patient that weighs 50 kilograms after we do our conversion from pounds to kilograms. So now we multiply 40 milligrams times the 50 milligrams equals 2,000 milligrams per dose. And then how many milliliters would we give to the patient? Okay, which is going to be 2,000 milligrams divided by 250 milligrams times 5 milliliters. That's a D over H times Q, equaling 40 milliliters. Body surface area. We use these to ensure safe and effective dosage for fragile and vulnerable populations, not just children. Any medications that is considered toxic, teratogenic, and other disease states are going to probably be dosed with these calculations, your chemotherapies and things like that. So you have your imperial formula, which is using inches and pounds divided by 3131. This particular one is for if you don't have the patient's weight in kilograms or centimeters, or the height in centimeters. You have your metric formula, or your metric formula is centimeters times kilograms divided by 3,600 squared. Don't forget the square. I just taught this in my morning class and we forgot the square a couple of times. So we want to make sure that we utilize that. Now, there are several different, as you noticed on the previous page, there are several different ways to find the BSA. If the patient is of normal height and weight, you may use a nomogram. A lot of doctors' offices have a growth chart or a nomogram that they might use in their offices. It's on the next slide, I believe, if I remember correctly. If you have a patient that is not of normal height and weight, you can use the following equations, and we mentioned them in the previous slide. Here's the West nomogram for patients that are of normal height and weight. You'll notice that in the middle of the box where it says specifically for children of normal height for weight. So an example would be pediatric patient has a medication for 3 milligrams per BSA per meter squared per dose. Her weight is 15 pounds and her height is 20 inches. Patient's BSA, we would figure that out. We would go ahead and use 0.31 for the patient's BSA, and then we multiply that by the milligrams per would equal the dose. Metric, we have a pediatric patient on 7 milligrams per meter squared per dose. We have her at 25 kilograms, and her height is 60 centimeters. So we multiply that, divide that by 3,600, and then eventually square that, and becomes 0.65 meters squared. And then, of course, we would multiply that by the 7 milligrams. So we're going to give the patient 4.55 milligrams per dose. So tips for success. We always want to practice, practice, practice. Double check your work. Use reference tools if you need to. Never guess. Use your calculator. Ask for help when needed. I occasionally have to ask a pharmacist, did I do this right, every once in a blue moon? So we all need to reassert. Sorry. Ask for help when needed. We all need reassurance and definitely need to avoid a medication area. And I really found this quote that's in this particular slide really appropriate for dosage calculation. Don't practice until you get it right. Practice until you can't get it wrong. Practice is what everybody needs. I still, to this day, love to do practice problems. It helps keep skills up and things like that. So I'm not falling behind. So resources for continued practice. Obviously, the National Pharmacy Technician Association is very well equipped to help us all as technicians for both our continuing educations as well as beginning our careers. The Pharmacy Technician Certification Board. Khan Academy is pretty cool when you're doing your basics, if you need to build up some of your basic skills. And PTCB Test Prep is really good for the math portion. Thanks, everybody. Remember that pharmacy is always changing, and the more open you are to the continuous learning, you're going to have all the keys to the kingdom, basically, to create lifelong success. Any pictures and cartoons? I love my cartoons in here. Anytime I use them, they're from Google Images, so I have to attribute them to that. And if you ever need to reach out to me, you can use my email, jmaceyko@pmi.edu. Thank you.